Hello, and welcome to the third webinar for the Home Visiting Needs Assessment Exploration and Planning Tool, presented by the Michigan Department of Health and Human Services Early Childhood Home Visiting Unit and MPHI. As we discussed in the introductory webinar, the Exploration and Planning Tool is used across communities in Michigan to identify home visiting needs and capacity to expand home visiting services. This is the third in a series of webinars that are designed to introduce communities to each step of the process. By the end of this webinar, you will have the information you need to complete step 3, which involves assessing community risk to inform your assessment. This webinar is recorded so that you can view it and share it as needed. However, your exploration and planning coach is available to answer any questions that occur to you during or following this session. If you need contact information for your coach, please email the Home Visiting Mailbox at mdhhs-hvinitiative@michigan.gov. To ask a question during or after this webinar, use the box just below the video. Let's begin. Today we will cover 4 topics. First, I will prompt your team to have a quick check-in about your progress so far. Second, I will describe the process you will use to complete the third step, which will involve assessing risk within your community. At the end of today's webinar, I will prompt a team activity to practice for this component, and then I'll review next steps. First, let's go over where this step of the assessment fits within the exploration and planning process. As a reminder, here are the 6 steps of the exploration and planning process. You began the process by engaging home visiting system partners and families, and some of you gathered additional community input via focus groups with families. Now you're ready to begin step 3, assess community risk. This step will involve reviewing population data to assess community risk. After this step, you will move into step 4 and step 5 to explore the reach and quality of home visiting and other services for families in your community. Finally, in step 6, you will explore community readiness to expand home visiting. Jump into step 3, we encourage you now to pause this webinar and take about 10 minutes to check in as a team or individually. Consider these reflection questions and identify what you've learned so far. What came out of steps 1 and 2 for you? Let's jump into step 3 of this process, assessing community risk. This step offers communities an opportunity to take a deep dive into data that tell you about your community and the needs of families. During this step, you will explore 3 types of data. You will begin by exploring demographic and cultural characteristics of your county or counties. Reviewing these data will ground your work in the types of diversity that are important to understand your geographic area. The second type of data you will explore are data about community risk. These data tell you about the types of challenges families face within your community. It will be especially important to understand where in the community these risks are greatest. The third type of data you will explore are data about outcomes, and specifically outcomes that can be impacted by home visiting. As you review data about outcomes, you will want to explore disparities or differences between population groups in specific outcomes. By the end of this webinar, you will be able to describe your community's demographic and cultural characteristics, the geographic areas in your community that face the greatest burden of risk, and the health outcomes of greatest concern. This step will play a particularly important role in the state-level needs assessment process we described in the Step 1 webinar. The data you gather and share will help the state to identify geographic communities at risk within your county that might not be visible in county-level data. The more you dive into your local data, the better we will be able to describe the needs across the state. MDHHS and MPHI have compiled data for each county and a small number of cities on demographics, risk factors, and outcomes that are relevant to home visiting. You're able to access these data via the online tool in REDCap under Step 3. You will have two options to explore. The first is in Excel, and it allows you to select geographic areas you would like to review and display them side by side. The second is in Word and displays data for a single county or city. Both files include references that describe the source of each indicator, the indicator definition, and any footnotes. These resources are intended to get you started, but at each step in the process, you will be encouraged to take a deeper dive. We recommend following a defined process to complete this step. Begin by identifying someone who can take the lead on pulling data beyond what MDHHS and MPHI have provided. Also, identify someone who can facilitate the process of discussing the data, documenting findings, and entering findings into the online tool. Next, review the data provided to you and identify indicators you want to add, indicators you want to look at for specific geographic areas, and indicators where you want to explore disparities. Pull together the additional data you need. The more information on what this might look like will be shared through this webinar. Once your data are ready, convene your partners. Follow restrictions outlined in your community for safe gatherings or meet virtually. Use the time together to review data for your county or counties and respond to the questions in the Exploration and Planning tool. During or following the meeting, enter your findings in the online tool. You may adapt this approach to meet the needs of your community, but consider strategies that balance efficiency with gathering robust input. It is important that partners, including and especially parents, have the opportunity to explore these data and give them meaning. Let's look in more detail at the demographic and cultural characteristics you'll be asked to review as a starting point for understanding the diversity within your community. If you're completing this process for multiple counties, you will review these data for each county individually. You will review total population, births per year, persons under 5 years, white alone, Black or African American alone, American Indian and Alaska Native alone, Asian alone, Native Hawaiian and other Pacific Islander alone, 2 or more races, Hispanic or Latino, white alone, not Hispanic or Latino, veterans, foreign-born persons, owner-occupied housing unit rate, language other than English spoken in home, households with broadband internet, high school grad or higher, percent of persons 25 and over, persons without health insurance, and median household income. As you can see, you will be provided Michigan and US data on each indicator as a point of comparison. You can also look at neighboring or sister counties in your region to see how you compare. The Excel file provided by MDHHS and MPHI will let you do this easily. In some cases, you might also want to review sub-county data to see if a specific area within your county looks different than your county as a whole. These data come from the US Census and are available online for sub-county areas such as cities and census tracts. It is important to note that there are many dimensions of diversity not captured on this list. You may want to add to this list based on other data you have available and what you know of your community. For example, it might be important to gather data about Arab and Chaldean populations in your area, or the LGBTQ+ population, or the Amish community. Any information you can gather and include about the demographic and cultural characteristics of your community will help you consider how home visiting can be implemented in ways that are responsive to families. The Exploration and Planning tool asks you to respond to 2 questions based on reviewing data about the demographic and cultural characteristics of your community. What are the key demographic and cultural characteristics of this county based on its census profile? Respond to this question based on the data provided by MDHHS and MPHI, noting findings that stood out to your group that you believe could inform home visiting in your community. What are the demographic and cultural characteristics of this county not visible in the data provided? Please describe how you identified the characteristics you share. For example, family focus groups, staff input. Respond to this question based on the other data you pulled in, as well as other sources of information available to your group. For example, you could include insights gathered from focus groups, other needs assessment processes, or the service populations of your partners. Use this space to describe dimensions of diversity that are not well reflected in population data. For example, you might have an immigrant or refugee community that could be served by home visiting but isn't well represented in community level data. Now let's review the community level risk factors you will be asked to consider. These data reflect stressors at the community level that impact child and family outcomes. They are important to consider because home visiting is not funded at a level where it can be provided to every family. As such, we want to be sure home visiting resources reach those families facing the greatest burden of risk in the context of an inequitable society. You've been provided with data on homelessness, percent unemployment, high school dropout, poverty, children in poverty, households speaking limited English, income inequality, households receiving public assistance, and childhood food insecurity. Since these risks are not often distributed evenly across a geographic area, we encourage you to identify cities, zip codes, school districts, or other areas where these risks are greater within your community. These risks are also not distributed evenly across population groups. Considering what you learned from your demographic and cultural analysis, you are also encouraged to explore differences by population groups. Additionally, these are not the only indicators that speak to community risk, and you are encouraged to pull in other data important to understanding what families face in your community. There are many data sources that can help you take a deeper dive into community risk factors. This slide highlights sources you can explore as you work to create a complete picture of the risk profile of your community. These sources are also listed in the hard copy of the Exploration and Planning tool. Let's look at a few examples of data pulled from these sites. This image comes from census data displayed on the platform datausa.io. This website has many additional indicators, some of which can be explored by census tract or demographic variables. This particular image for Ingham County displays median household income by census tract. Through the shading on the map, we can see that there are census tracts with very low income residents and census tracts with very high income residents. This illustrates how important it is to look at how risk factors vary by geographic area within your county to understand where families are facing the greatest risks. One strategy for exploring geographic differences is by looking at school districts. These data pulled from mischooldata.org, operated by the Michigan Department of Education, displays graduation and dropout rates for the school districts in Ingham Intermediate School District. These data can be downloaded into Excel and graphed to provide an even more user-friendly view. However, even in table form, we can see that for many area school districts, the dropout rate is less than 1 in 20 and less than the statewide average. In the Lansing School District, the dropout rate is 1 in 5. This type of exploration can help identify areas of risk that could be much less evident at the county level data. This final example comes from data pulled and reported by the Ingham County Health Department. In many of your communities, your health department or nonprofit hospital will have published a community health assessment within the past few years. These documents are publicly available and often contain a wealth of community-level data. This example illustrates disparities in labor participation and unemployment by race and ethnicity, and it shows us that the burden of unemployment is not evenly distributed across racial and ethnic groups in the community. These three sources and types of indicators are shared to illustrate the types of information available to you and your partners. These sources are readily accessible and will help you tell a much richer and more complete story of the risks facing families in your community. After reviewing data about community risks and discussing these questions with your community partners, you will enter your findings into the online tool in REDCap. Here are the key questions you will be asked to reflect on. 1. What do the data suggest about risk within this community? When responding to this question, you can focus on the data provided by MDHHS and MPHI. Note how the county compares to the state or other counties in the region, and highlight risks that especially concern your group of partners. 2. What other data did you review about elevated risk for families in your community? What did you learn? Your response to this question should be informed by other data that you pulled into the process. Be specific about the indicators you reviewed and the source. 3. Are there pockets of elevated risk that are masked by county data? If so, describe and provide data. Use your response to this question to highlight geographic areas or population groups that face elevated risk. This is especially important for counties where county-level data masks risk faced within specific census tracts, zip codes, school districts, or cities within the county. The online tool includes a space to upload additional data you use to draw conclusions. 4. What other evidence of risk for families in this county are not visible in the data provided? Please describe how you identified these risks, for example, family focus groups or staff input. In some cases, data about particular risk factors are not available, or data about the experiences of specific population groups or geographic communities are not available. Use this question to describe findings generated through other methods, such as focus groups or staff input. Finally, let's review data on outcomes. This set of indicators was selected based on evidence that they can be impacted by specific home visiting models. They are important to consider because different models have different strengths. When selecting which models to promote or expand, it's helpful to align the choice of model with the outcomes of the greatest concern within a community. You've been provided with data on preterm delivery, breastfeeding at delivery, immunized 19 to 35 months, low birth weight, infant mortality, maternal morbidity, maternal mortality, teen birth rate, neonatal abstinence syndrome rate, binge alcohol use, marijuana use, non-medical use of pain relievers, illicit drug use, child maltreatment, foster care age 0 to 8, not proficient in 3rd grade reading, special education, crime reports, juvenile crime arrests, and domestic violence. Many of these outcomes are experienced differently by different population groups. These differences are called disparities. Often, disparities are created by forces such as racism and other forms of oppression that make optimal health and well-being much more difficult to achieve. Home visiting can be a force for equity when informed by an exploration of disparities within a community. For example, we know that home visiting impacts birth outcomes. We also know that Michiganders who are African American or Native American experience an infant mortality rate 3 times higher than Michiganders who are white. While home visiting cannot undo the trauma of racism, when offered to African American and Native American women, it can provide trauma-informed support, culturally relevant information, and linkages to other services that support good health for moms and babies. Being mindful of disparities across population groups within your community can help you ensure that your home visiting programs support more equitable outcomes in your community. There are many data sources that can help you take a deeper dive into health outcomes. This slide highlights sources you can explore. These sources are also listed in the hard copy of the Exploration and Planning tool. Let's take a look at a few examples of data pulled from these sites. One way to explore health outcomes is by looking at change over time. This can be especially important in communities that have really worked to tackle a specific health outcome, and in communities that have had change that could adversely impact health outcomes. This example comes from Kids Count, which compiles a substantial amount of data related to children and families and publishes it both in a hard copy book and online. It is searchable by county and breaks down data in a variety of ways. This example from Marquette County illustrates that while moms in Marquette County are less likely than moms in Michigan to have less than adequate prenatal care, the percent of moms with less than adequate prenatal care has climbed substantially since 2010. The change over time raises a flag that would not be apparent by just comparing Marquette to the state average. The Michigan Department of Health and Human Services houses Michigan's Vital Records, which contains a wealth of information relevant to home visiting. Many interesting indicators have been explored and reports are available on the michigan.gov website. This example focuses on the teen birth rate, and it helps us visualize how much the teen birth rate varies across counties in Michigan, as well as in the city of Detroit. Exploring health outcomes by geography can point to areas of your community where strategies like home visiting might be most helpful. This link takes you to a really helpful website where the Michigan Department of Health and Human Services Maternal Child Health Epidemiology section houses a lot of useful data and reports. This example comes from one of a series of reports produced for Michigan's regional perinatal quality collaboratives in 2019. These reports are available for the whole state and provide a lot of interesting outcome data. This particular image illustrates the infant mortality rate for census tract in Region 4, clearly highlighting spots in the region where the infant mortality rate is highest. This last example illustrates how you can pull indicators for yourself from MDHHS's Vital Records site. This example focuses on low birth weight in Genesee County. The site allows you to pull data in a variety of ways. In this case, we're looking at race, Hispanic ancestry, and age. We can clearly see that babies who are Black are much more likely to be born with a low birth weight than babies who are white. There are so many data sources, indicators, and ways of exploring differences. It can be overwhelming. In order to help you think through your options, there is a table in the hard copy of the Exploration and Planning tool that looks like this. The first column offers suggestions for types of subgroups or geographic areas you might want to explore. The cell at the top of each column can be filled in with indicators your partners prioritize to help explore in more depth. You can draw from the indicators provided by MDHHS and MPHI, or add other indicators important to your community. You are not expected to take a deep dive on every indicator, but exploring the indicators that are most important to your community at a deeper level is a critical component of telling the story of risk and outcomes in your community. After reviewing outcome data, please discuss these questions with your group and enter your findings into the online tool in REDCap. You will be asked first, what do the data suggest about outcomes of concern within this county? Your responses to this question can focus on what you noticed in the data provided by MPHI and MDHHS. You should note indicators where outcomes for the county are lower than the state or other counties in the same region, for example. The second question is, what other data did you review about outcomes of concern for families in your community? What did you learn? In response to this question, describe your findings related to disparities in outcomes in your community. Make sure to describe your data sources and the specific disparities you found. The third question is, what disparities in outcomes across race, socioeconomic status, geography, etc., are of concern in this county? The fourth question is, what other evidence of outcomes of concern in this county are not visible in the data provided? Please describe how you identified these outcomes, for example, family focus groups or staff input. Use this space to describe other information you have about outcomes that are unmeasured or not available for the groups or geographic areas of concern. You can pull in focus group findings or draw from staff wisdom, for example. This step concludes with asking you to interpret your findings. You will be asked to identify the outcome areas of greatest concern in your community, as well as how you arrived at those conclusions. It will be important to provide clear, specific information about the data you use to identify outcome areas of concern. This information can be used to inform decisions about the model or models that should be promoted in your community. Now let's take a look at step 3 of the exploration and planning tool in REDCap. Once you are in REDCap, make your way to step 3, assess community risk. Make sure you have selected the county for which you are entering information. You will notice there is a Word document attached here titled HVNA Exploration and Planning Tool, and an Excel document attached titled Demographics Risk Outcomes by County. You can also access the Excel workbook as a Word document for the county you selected in the attachment below. Review these documents before answering the questions for step 3. If you are interested in viewing data from other counties, you can indicate your preference here. Text boxes are provided to input your answers to the questions we covered during this webinar. If you used other data in your review, you can upload it using this Upload File button. Remember, when you have completed step 3, to check Complete and save and exit the form. Let's take a moment to apply these steps to your own teams. At this point, we encourage you to pause the webinar and take about 30 minutes to explore the 3 websites listed above. First, go to the website or complete the search as noted. Second, Spend some time exploring, specifically looking for data related to your county or counties. Third, notice what is available at the sub-county level. Fourth, notice what is available for different population groups. Repeat this process for the other two sources. You might save or print information as you go. Once you are finished, note or discuss as a team how you might be able to use some of the information you found during this quick 30-minute search. Finally, let's review what the next few weeks will entail. As mentioned, please enter your findings for this step into the online tool in REDCap. Reach out to your coaches as questions arise, and update your timeline for the rest of the process. And once you are ready, please watch the next few webinars outlining steps 4 through 6. As you continue this process, you will have questions and needs. We are here to help. Reach out to your coach anytime for support. We're committed to learning as much as we can about need and capacity to expand home visiting across our state, and we're committed to your success. Thank you.